Hi, I'm Chad Kohler. I'm the CEO at Skywood Recovery. I'm here with our Dynamite Chief Nurse Practitioner, Heather Kidder. We're going to talk a little bit about the options for medication-assisted treatment. So Heather, talk us through a little bit about the options for MAT that are available at Skywood.
Sure. So we have medication-assisted therapy. It's in addition to therapy step programs. It's not in replacement of, but in addition to. We offer medication-assisted therapy for alcohol use disorder. With alcohol use disorder, there are several different medications that you can use. We offer antabuse. That one's been around for a while. That one is a pill. You take it once a day. It's for people who respond well to negative reinforcement.
Got it.
The way this medication works is that it stops the stomach and intestines from absorbing the alcohol, so people start to feel ill and sick. Some of the side effects once you take the medication and use alcohol are either vomiting or some people relate it, they feel like they're having a heart attack. They get really hot, red, sweaty. So there's that medication that you can use. Another medication is called Campril, also comes in pill form. This one has to be taken 3 times a day. We're not sure the exact mechanism of action for this medication, but we do know that it helps attach somewhat to the receptor sites in the brain that alcohol would normally occupy, so it helps reduce cravings in that way. It also boosts dopamine levels, so it does help boost the mood somewhat, so it's helpful in that way as well.
Because that could be a symptom of post-acute withdrawal, right? Is a lower dopamine and kind of this lingering depression.
Yeah, so actually we find Campril use in early recovery to be very beneficial. The other medication that we have for alcohol use disorder is called naltrexone. Comes in a pill form, which you take once daily, or it also comes in an injectable form, which is once every 28 days. That one is a mu-opioid receptor agonist, so it actually attaches fully to the receptor sites in the brain that alcohol would, and so in that way it reduces cravings. Because those receptor sites are also occupied, if you do happen to relapse or use, you don't get the same effect, so you actually use less often during the month and drink less. So it's very helpful in that way.
And I would imagine that any drugs that support craving reduction in early recovery have to be super helpful.
Absolutely. Yep. We do find them to be very helpful. And these 3 medications actually work differently. So you could potentially take all 3 together because they have different mechanisms of action.
Got it. And what are some of the benefits of the injectable over the oral? It sounds like one of those medications has an injectable format.
Yes. So the naltrexone comes in Vivitrol, which is the injectable format. The benefit of that is you don't have to remember to take a pill every day for it to be effective. And you also don't have peak and trough levels of medications where you have the medication it's attached to those receptor sites and then wears off during the day. With the injectable form, those receptor sites are occupied for that full.
Got it. It's a little bit flatter.
Yes, absolutely. Yep.
And then for opioid use disorder,
Yes.
what are some of the medications that are commonly prescribed?
Yes. So you can also use the naltrexone or the Vivitrol to help with opioid. It also attaches to those opioid receptor sites. So the cravings are less generally. And the other is Suboxone. So that is, it comes in pill form, it comes in sublingual like strips. Those can be taken once a day, twice a day, 3 times a day, just depending on what the cravings are. That one also comes in an injectable form called Sublocade.
Okay.
And that one is given every 21 to 28 days. Again, the benefit of that is that you don't have the peak and trough, you have that steady state.
Got it. That Sublocade is a newer administration route, correct?
It is. So it's not IM, it's given subcutaneously, just under the skin. It actually forms a little ball just under the skin, and so it slowly dissolves over that 21 to 28 days.
Very cool.
Yeah.
Great. Thank you so much.
You're welcome.